Insider. Welcome to this edition. We often hear about terminal knee extensions as a way to increase VMO or Vastus Medialis obliquus and Vastus Medialis activation of the knee for patients and clients that have knee pain. Oftentimes we hear like lateral tracking patella, chondromalacia patella, those kind of knee issues come from the patella tracking laterally. But what we really need to focus on is getting the VMO working. And we hear about these exercises, terminal knee extension is when VMO becomes most active. That is true. However, doing terminal knee extensions is probably not the best way post-surgery or after your post-surgery rehab to get that muscle functioning better. A much more appropriate way, once you've done terminal extensions, if that's all they can handle at that time, is to put them in a functional position and help them connect the Vastus Medialis to the whole lower chain, meaning the big toe up the medial leg to the VMO, through the adductors to the deep glute maximus. Okay, so those deep lower fibers of the glute max. We want to make sure when we train our clients, squats, lunges, step-ups, that they're focusing on that connection to the big toe, medial side of the foot, up the inner leg to the VMO, adductor, glute max. So we'll do this with Ellen now. Ellen, go open your back toes for me, please. So I'm going to make sure she stays aligned here. I want to make sure that she keeps a tripod in her foot, big toe, little toe, keeps some arch support there so she doesn't just roll into pronation. And I don't want her to roll into pronation through her knee either, so I want to make sure that her knee stays aligned. Now this contact is important with the foot because that's going to send that reflexive signal back from the foot to the hip to the trunk extensors. So, and it will also help her activate that VMO. Okay, so I want to make sure that maintain this contact, line up the tibia shaft down the second ray, and I'm going to have her pre-activate her core and get some pre-tension in that Vastus Medialis. So she has tension in her glutes. Again, ask for permission before you put your hands on somebody's glutes. So I'm going to palpate her glutes and her VMO. I want her to go down into a split squat position. So come down, hold right there, maintain this alignment. I want you to lift through your glutes. I'm going to cue her through her glute and to lift up through her knee. So she's going to bring her body weight up over that leg. I don't want her to come down again, and snap the knee back like most of our clients do. They just bring the knee back. I want her to bring her weight up over the knee. So she stabilizes the foot, activate VMO and the glute max. She's going to come up over that leg and maintain that alignment. Do two more, please. So make sure I'm going to activate through here. I'm going to facilitate it by giving her some feedback. Come back up. I want to make sure she feels it in the glute and here, two primary areas. If she can't get it, I can give her a little bit of valgus force, so come back down again. So she's forced to use that VMO a little bit more efficiently, and the glute max. Okay, so the key again, get the contact of the big toe, proper foot position, pre-activate the VMO, connect to the glute max, have her use that glute max and those hip extensors as a primary means of lifting her out of that position, and make sure that she moves her body weight over top of that lower extremity. That's the best way I know of how to activate the glute max and get it integrated into the full lower kinetic chain. This is Dr. Evan Osar with Fitness Insider. Have a great day. This is Dr. Evan Osar with Fitness Insider. In the last video, we talked about VMO activation, the contact of the big toe, little toe, and heel of the tripod of the foot during split squats, squats, step-ups, and activities like that. When you take some of your shoes off, you can really start to see the dysfunction of the foot. And we did that in the last video. We saw the big toe coming off the ground quite a bit. It was hard for Ellen because of stability issues to keep that big toe down. When we're retraining, we want stability. We want specificity. So I'm going to give Ellen a little bit of support so she can focus on all the mechanics we talked about, but not have to worry so much about the stability factor. The reason I don't have her do this with shoes on initially is so she understands where the foot needs to be, so she can feel and get the feedback from the bottom of the foot into the entire kinetic chain through the foot. Okay, so I'll have Ellen perform it again. I want the big toe, little toe contact. I want the alignment through her tibia. I want to make sure she activates the VMO and her glute max, and she's lifting it again. Come down again. She's really pushing off that glute max to come up and over that lower extremity. Go again. Perfect. To progress her, what I would do is do is just have her take a step, meaning that she comes down, and then take a step forward with your left leg. So she comes up over that extremity and then come back. And she would actually put her foot down. So do it one more time, come back up, take a step, put your weight down, perfect, and come back down. So I can guide her to what the proper mechanics to shift weight onto the next leg, which is very important for your runners and for people returning to a normalized gait. Hopefully this was helpful and helps clear up some of the misconceptions about what the foot should be doing. Have a great day. It's Dr. Evan Osar.